Thank you, Anna. Hi, everyone. I'm Hanovi Schoonover, the Training and Resource Coordinator for Redwind Consulting, and welcome to our webinar. Today, we'll be going over mental health needs and culturally specific therapy modalities for children and youth. Joining us today is Debbie Manuel. Debbie is a member of the Navajo Nation, and she serves as a board member in the Morning Star Leaders, an Arizona nonprofit that empowers Native youth while focusing on core values of indigenous life through cultural programs and leadership opportunities. She is energized by leadership efforts that foster stronger communities, young leaders, and Arizona tribal nations. She earned her degree in social work, and she is a graduate of the Northern Arizona University and Arizona State University. She is recipient of the 2016 Arizona Governor's Volunteer of the Year Award, and she is recognized for committing her life to serving urban and rural youth throughout Arizona. She has served the board of the Hopi Education Empowerment Fund, the Arizona Foundation of Women, the Office of Indian Education, and recently finished her third term as the chair of the Parent Advisory Committee for Mesa Public School. I'll now turn it over to her.
Good afternoon, everyone. Yate. She sanjakin inshle, telna besni bashish chin, titna jini dashache, kabahan dashanale. I just shared with you one of the most important frameworks for, being indigenous. Most people, most tribes offer the same type of introduction when they're getting started. And so I just wanted to share a little bit about who I am and why I do the work I do. But I am a citizen of the Navajo Nation, and I live in the Salt River Pima Maricopa Indian community, which is located in the eastern part of Scottsdale, Arizona. And I am the mother of 3 children. I'm married to my husband, Royce Manuel, and together we have spent many decades serving Native American communities and in different capacities, some in outreach and crisis intervention, others in education or in clinical settings with both individuals, groups, or family settings. So this work has been really critical in serving families of all ages, so I'm excited about that. To ensure that I'm moving along, I'm going to go ahead and get started, and feel free to ask questions as we move along. But as I get started, I want to take you on a journey of the experiences that I know as a child and what I've been through in my time. I really want to make sure that you have a good understanding of children and what happens. So I'll get started right now. Can we move over into slide, please? As I make my way out the door, I feel the vibration and growl in my empty stomach. All I can think about is the comfort of Grandma's kitchen, the aroma, the smell, the calm and gentle sounds of her voice on the floor beneath her feet. I begin to walk as gently as my 4-year-old legs could carry me. Along the dirt path beneath my feet, I could feel the small white pebbles. Some have sharp edges, but I do my best to stay light on my feet. As I look back over my shoulder to see if anyone notices me, I see a white trailer trimmed in brown trim and a rough addition added to make room for family members. In this home, my auntie becomes my mother after my mother's death. Living with her each day was unpredictable. Just as I redirect my line of vision toward Grandma's house facing west, I jump feeling a sharp pain in my foot. I grab my foot looking as the blood begins to surface on my skin. I drop to the ground with my legs folded and look around. No one is in sight. No mom, no uncle, no grandma, no brothers. I look only to see the dirt path ahead of me. As my eyes follow the path, I also see shiny, broken bits of glass. The sharp pieces, rusted pieces of wire are at my feet, and a nearby red anthill. I continue looking around, and still no one. I do my best to hold back the tears forming in my eyes, feeling the sting and holding the lump in my throat. But I continue to find myself holding my foot. As I sit and wait, I start to notice the way the ants are helping each other, carrying what's needed into their earth home, working in unison, staying together in rhythm, building their home. These ants were a family. How did I know as a child, at the mere age of 4, that something was not right? From a home where days were uncertain, to the food insecurities, to the lack of basics like shoes or adult safety and support. This child learned from very early on that I needed to do things that I could control. The only focus were on the things that mattered. This childhood experience begins to shape my mind at an early age. Knowing the complex difference at an early age is what helped me throughout my lifetime, but also has helped me overcome hardships throughout life. When I look at things that matter and compare it to the things that I can control, I realize that there's only a small sliver that I actually can focus on or can influence as a child. As babies, we often represent blessings and gifts to our families. As my thought is that when my mother carried me, I was planned. It was something special, something beautiful and important. I think that we can all agree that babies are powerful. I think we know they're powerful because they tend to make adults regress anytime. In under 60 seconds, you can see an adult who is fully in control of a situation be able to burst out in laughter or make the craziest cooing sounds, squishy faces, and get even the most grumpiest of adults to smile big. I think we can all relate to that. Well, most of the time. We'll save the talk about sleepless nights for another time. But in general, babies represent newfound blessings in our lives or gifts to our families. We dream of the legacy they are to our family clans, to our names, to our culture. And then something happens. The reality in most homes of our children's, and sometimes even our experiences, are the reoccurring episodes of alcohol, drugs, or violence. These issues we see as families experience will not only begin to create blueprints for biological and mental health, but it begins to create neurotransmitters in their brains. These are the superhighways. These highways begin to ingrain these memories, these thoughts, these experiences for a lifetime. Our children walk into our learning spaces and begin to tell a story. They describe what was for dinner, which sister broke grandma's favorite cup, and how grandpa used the axe to prepare wood, and how they helped bring in the wood for the day. These same children also will describe what happens when no one is watching, or how they went to bed hungry for several nights in a row, or how grandma actually broke the cup on the table out of an angry burst of violence. But there are those who are standing nearby watching this story unfold. They watch, holding their breath, their eyes darting around the room, assessing how to get through. This outside force comes together. These are aunties, they are uncles, their extended family, their teachers, their neighbors, who delicately walk and find ways to improve the outcomes of our children. What could these be? I know these people, and I think you know these people. Many of you on the line right now are probably one of these individuals. I know these people eventually showed up with carefully chosen words, their indirect conversations walking themselves through the room. Filled with tension, they offer these ideas or ways to get food on the table, questioning how much longer they need to feel this heavy pressure and burden before they can no longer hold back their breath. We only hope that families will find ways to cope in areas so that they become healthier. And how I see this best are through songs, the prayers, and the faith we have in our indigenous societies. When I think about our prayer, our song, our prayers, and our faith, I think many people as indigenous people can draw on those for strength, for courage, and in time, those pieces of medicine I see can really help one endure, overcome, and persevere. But often we can't do that without a traditional offering. We're unable to do that without bringing balance back to who we are. Often we think about, well, how do we handle this when we have communities, tribal communities that are rich and faith-based communities and resources that are available. No matter what background an individual is, bringing balance back into a place where our families might be struggling, helping them to understand that this sense of hope by laying down this medicine or by pouring this water and giving it back to Mother Earth, by praying to that water and giving it back to Mother Earth, there's a sense of balance that comes with that. It restores one's faith in what our universe has to offer and the main elements of who we are and where we're going. So when I think about these concepts, traditional offering creates that sense of hope and that purpose that's really important to serving our families, no matter who we are, where we're at. We also think about how to engage all of these age groups. I think no matter what age we are, we have something to give back to our families. If it's through songs, prayers, faith, we have the ability to restore our families in a way that will only strengthen them, but also allow them to cope with some of the unbelievable pressures that they are dealing with. One example that I think about is, because I'm Navajo, I think about one of the critical ceremonies that we experience, and that's called the Canosa. This is the coming of age ceremony, and it takes place the actual facilitation takes place over a period of 4 days, but there's a lot of planning that happens before those 4 days, and then there's a lot of reverence that takes place after the 4 days. So when we think about it, it takes probably half of the moon cycle for this to take place. But in the process of this, it's beautiful because we see family members come together of all ages. We see aunties and uncles. We see our parents connect with each other in ways that allow us to connect with family in a kinship framework, and also it naturally creates a resiliency framework. So in this example of Canosa, we know that there is seasonal experiences that everyone experiences in this ceremony. I think about some of the experiences that I've had with my own children. 2 of them experienced some of the harsh conditions of winter in 0-degree temperatures, experiencing a ceremony where we didn't know whether or not there was going to be enough wood. We didn't know if the cake would bake in the earth oven. We didn't know, but we all pulled together to make this possible. And in that, we recognize that our own strength and our own courage and perseverance that came through this was something as a mother that I could give to a child and say, this is how we're going to overcome this, no matter, despite the conditions outside, despite what it seems like, this is just going to make us stronger for seasons to come. Having ceremony is such a strong way to convey to our children and to our family members that they can overcome experiences and challenges before them. Through these kind of ceremonies, we're able to remind people who participate, even as a guest or as a visitor, that this is possible. So as we're working with children who are struggling either mentally, either with medical conditions or trying to find some sort of hope and faith, there's opportunities in these ceremonies. Even in the smallest ceremony of understanding water, of prayer with water, understanding what it means to go outside early in the morning to offer prayer and to restore the faith in people so that they understand that no matter what the circumstances or what life is handing them, that they can overcome these situations. There's also going to be a time where, as providers, we come across a road, a crossroads, and we have to determine from those crossroads where we're going and what we're going to do, how are we going to move forward. And in this process, we're also learning more about ourselves. Is what is at stake here? And when I think about what is at stake, I also think about how our families, our own families as providers, are struggling. Where are they going to go? When mom is out in the field working with children, or uncle is out there serving the family, providing transportation, what happens to our family? So in a position where we're compromising our own families to serve others, we're always going to be caught in this. And often we look at decisions that we have to make, but in balancing our work with our family. When we think about this, we think about the Maslow's hierarchy of needs. This is something that we have to think about. It's really important. If you're a professional, you've probably seen this at some point in your life, or you've seen it in some training or conference. But this is a good time to ask ourselves, when we deal with pressures, both personally and professionally, how do we handle those difficult situations? We're dealing with tragedy more frequently than we'd like. Those degree of tragedies can be very mild. They can be moderate. We can balance them, but sometimes they're acute or they're chronic. And so as we're serving families, we have to really look at how do we begin to professionally balance all of this and also integrate self-care. We also ask questions like, what makes this so difficult? What part of it? Are we just putting out a flyer, or are we really looking at some of the root causes of what's happening here? How do we create an environment to foster the well-being? Who are we as parents or as individuals? And who are we serving? What are they like as parents and individuals? When we look at some of the basic needs, the psychological needs of humans, we think about essential things of food and water, the sleep that's required. We know that humans are more effective in what they're doing when they have enough sleep, and that they're taking in self-care, and that they're also loved. So when we think about the children that we're serving, they require those daily hugs. They require those daily snuggles. They require the healthiness of that all. And also for us, is sitting and breathing with them, helping them to understand how important those basic psychological needs are. As we're growing, we're also recognizing that there is the health needs and the security of the family, resources, employment. Employment in this day and age is one of the most critical things that we need. So how do we help individuals and families, even young adults who are often dealing with being a support system for maybe a single parent income? Today we can see youth who are often working one job during the school year, if that's a part-time job. In the summertime, they're often working two jobs to help to support parents, and sometimes parent doesn't have any support at all. But knowing that this security is required, it really helps us to begin to see what is essential for this person or this family to be able to be stabilized. When we're looking at the sense of love and belonging, we see family friendships and intimate relationships that are powerful. When I think about intimate relationships, I'm not so much speaking of a sexual relationship, which is necessary to be healthy, but intimate relationships where there's trust, where there's honesty and there's transparency. Often in today's world, we don't have those honest and trusted relationships. As much as we'd like to have them, they're not always available to us, especially if there's a family who is dealing with some instability. We're constantly thinking of how do we help this group, this family, this area, these people, and how can we do that? And often that really starts with trusted, honest, intimate relationships with people, if it's with a sister or with a relative or with even the service providers that are there. We have to build those and cultivate those relationships. When we think about the confidence of individuals, we also have to think about how they feel, how do they extend or convey their respect to others, and how are they respected by others. Sometimes when individuals are victimized in situations, they often don't feel respected by their companions, by their spouse, or even providers. Sometimes they might feel that they're not being heard, and these are really critical for the people that we serve, if they're children, adolescents, or young adults, or even single parents who are trying to get on their feet. We also recognize that self-confidence is critical. It helps to boost their self-esteem. And then there's a place where people get to, and I love this place. I love this place. I've actually witnessed for myself 10, 15 years after serving some of the people that I have, that these individuals, some of them are women, and how they come back and they're so creative. You can see their strength in their hearts, their emotionally, their intelligence, their emotional IQ is extremely high. They understand what's happening, and they are spontaneous. They're problem solvers, and as providers, when we're working with families or individuals, we don't see this happen overnight. It's cultivated over a period of time, but it's beautiful when you're able to see those individuals come and heal and find healthy ways to cope, and then they return to just say thank you, And so over a period of time, individuals, families, children, they can start maybe with the struggle at the lower level of this hierarchy, and then they begin to move and they begin to climb to the point where they're active, they're engaged, and they come in excited about life and what's ahead. And I think that when we're working with families, these are really important, knowing that somewhere ahead in this divided road that we had to take is that this exists. But we know that can't exist without the understanding of change, and how the complexity of humans is really ranges from day to day, especially if children or adolescents are in unstable situations. Young people might ask how they may not use these words because they don't have the vocabulary, but they might ask themselves, how are we coping? And even you as a provider might be asking, what tools are we using? What kind of impact is this going to make over time? Are they effective? Are these tools outdated? That's something that's really important as we work in tribal communities. We don't have the best of resources, or they're limited resources, or when there's a need for technical assistance or guidance or best practices, we don't always have those things sitting right there in our office. We might have to search for them, but we need to know that those tools are the most effective means, and that are identified as best practices. But when I think about the impacts we make today, going back to the story, is they may be immeasurable. We might not be able to see the change instantly happening with someone that we work with, but it's there. These individuals are capable of coming out of situations, if they were in domestic violence or sexual assault, if we encountered somebody in corrections that needed that help, or someone who was dealing with different levels of suicide. We know that these humans are capable of doing that. It's a matter of finding the right type of tools that are necessary to help that person grow. I think one of the best quotes I've seen is to help reinforce our impact on tribal communities is to always remember that a society grows great when old men plant trees whose shade they know they will never sit under. And so when I heard that quote, I always think about it as like the work that I'm doing as a provider, serving children and adolescents is not visible. It's almost invisible for many, many seasons. But one of the images that I think about when I'm working with people and that, while other providers might see, is that we have to believe in these systems and children wherever they're at. You know, they might start from the lower level of this, I won't do it, to this really stubborn mentality is I can't do it, and slowly with, you know, some encouragement, we hear them begin to say, well, I might want to do this, or how did that person do it? I want to try it too. And they elevate themselves to I can do it, I will do it, and celebrate with them, even if it's 10 years later, saying, yes, I did it. When I think about these circumstances that our families are dealing with, we're really taking a look at ourselves. Taking care of yourself doesn't always mean me first. It means me too. When I think about the work that we do with children, it can be very challenging. It can be very, it can be heavy. And I think when the work that we do with our young people today, some of those issues are invisible. When we see young people dealing with depression, different varying degrees of depression, we might see them mild, there's no signs, and we see another youth or adolescents deal with some moderate to severe issues of depression. And then we might see some acute and chronic issues of depression. And some of this, when we deal with this time and time again, can get really difficult on us as providers. You know, how do we practice the self-care? What are we doing, and how are we going to be able to get through this? Too often we continue to do this work thinking this is all we can do, but knowing very well that we are unable to impact the kind of change if we're not taking care of ourselves. Often what I share with people is to believe in yourself. I think the greatest kind of impact we can make with children is when we begin with ourselves. If we know that we can make decisions based on our emotional IQ, knowing how we are, then we can make the greatest impact when we're meeting with individuals. As I see others come together and recognize that, I can compare one provider with another and say, this individual is doing really well. How are they doing it? We have one counselor that I've worked with in the past where he was extremely effective in what he did. And I watched really closely is like what makes him extremely effective. A big part of it is that he engaged in self-care. He had his own self-meditation when he would walk. He would make it a point to walk, at least 3 miles a day at the nearest venue. For him, it was a local mall that was nearby. He would walk, and during that time, I seen it as meditation. Another thing he would do is he would practice beadwork. He would beadwork the rattles that he created, clean the rattles, and it was a form of self-meditation. And then, although he dealt with medical conditions, arthritic medical conditions, he used the beadwork to help him to regain balance. And during times in his life, he was able to gift those to people he knew supported him either in some way in the work that he did, and it was always unexpected, but that was his way of passing things forward and bringing balance. And I think that when providers are able to do that, they're also able to serve families in a much more powerful way. I think that's one of my strongest examples I have of self-care and being able to work with children in a way that really helps families. I know that I've gone through this quickly, but I also wanted to make sure that we have time to help answer some questions that might be out there. Do we have any questions?
Remember that you can put your questions either in the chat box, or you can click on the arm icon up in the top left, top middle, and that will show us if you have a question or comment. You can also send a message directly to either Debbie or I if you prefer to remain anonymous.
So while we're waiting on questions, some of the best experiences that I've had with individuals has been with, not the sense of empowerment, because I believe that I'm simply reminding people that I'm working with of the teachings that they've either received from their grandparents, that they've heard somewhere in either a ceremony or a conference or a training. Often people will ask, how do you know which tools to use? I really don't. I tend to just let people know, this is just a reminder. I know somewhere along the way in your lifetime somebody has taught you this, and what I'm saying or sharing is not new, but it's something that I learned, as a child, or experiences within a family framework, and I apply some of those things to my professional work using the tools that are available to me, like the stages of change or the Maslow's hierarchy, or a person-centered training, or a strength, focusing on strength and helping to build and cultivate trust among both the provider and either the adolescent or the young adult that I'm working with. So blending the two and weaving them together, I think is important. When we look at some of the national interventions, we see some best practices there that are really, really effective, but sometimes just pulling from around you from some of those natural resources within a community setting is also powerful. Many times those aren't documented, they're not available on some written plan somewhere. It's just knowing and watching and listening to the people and seeing what is most effective for them. That's been a way that I've been able to work with people that maybe not from my community, but here in a tribal community that I live in, which is not a tribal community that I'm enrolled in, but just watching closely and seeing what works for them, seeing what they draw strength from, and taking that and integrated it into any type of intervention that is already well documented. That might be activities, that might be songs, that might be even spending time outside, which here in the desert it's a little bit hard to spend time outside, especially right now when the temperatures are extreme, but it still feels good. We can find shade, we can go next to the river, we can go into a place and try things that are not always easy to do alone, but you can do them together in a small group.
Do we have any questions?
We have a good group today. We have about 20 people online.
Yeah.
Yeah, it's a good group. I can add a little bit more information on something that I've changed over time. When I started doing outreach and intervention, it was probably about in the early 90s, and over time I've often shared this with some of my mentors here at Arizona State University, is that as a provider, I had gone through the crisis intervention framework, worked with in a crisis setting for probably about 1.5 to 2 years, and our program saw the need to do more outreach, so they moved me over to outreach to after that we were responding to some of the calls that were coming in, or some of the referrals we were getting. And then after a certain period of that, they said, well, we need to get some more counselors on board for clinical counseling. Can you do some group work? I said, yeah, I can do that. And so locally, I decided to do group work over in a local community tribal housing area. I did group work over in the high school and over at corrections with both juveniles and with the adults, and with both genders. And I saw over time how this was really valuable, because I seen the growth of individuals happen if we were doing outreach to, actually finding an engaged audience. And then moving over to education and ensuring that these individuals were always included in some way, if it was at the clubhouse, at the schools, or face-to-face time at their home, or in a public setting at the local community building. We were always providing some sort of framework. So after the education piece, there was some federal grants that came available for suicide prevention, meth, HIV prevention. And I saw how powerful those prevention models were. And so using best practices and integrating this information, I realized that over time I saw a wide audience within a tribal setting evolve over time. And I want to say probably after 2015, I said, I needed to decide to take some time for self-care. And I asked myself, what would that look like? How do we take care of ourselves to be stronger providers, to be stronger champions of healing and of coping? And I thought, I'm just going to take some time off here. And so I started to study in a different way. And I started to work with youth in a leadership capacity. I know in our tribal settings, there's the priorities for doing outreach for individuals who are struggling. If it's children, adolescents, or adults, young adults, there's this high priority. And in the meantime, we have some healthy individuals who are doing really well, who don't get much attention. And I thought to myself, that's just kind of, we need to balance that out. How do we, because these young people who are needing that support have the strongest potential to become providers themselves, to become servants in the community in a service capacity, or they have a chance to become tribal leaders themselves, both informal and formally. And so I said, what, I think it's time for me to switch gears and give these young people a chance to show me what they know, and to take time to listen to them. And started working on a leadership capacity with the mindset that these young people already have that medicine. They already have the vision. They already have these ideas that will make their community stronger. So as I began to work with them, I started to really see the power of their medicine, of what they had inside. They had this fortitude in them to just make things happen. So when I shifted gears from providing crisis intervention to education and prevention, I really went to a place where I was really working with young people who had the capability of helping themselves, of aspiring. With just a little bit of guidance and framework and support, they were able to make changes in their family systems, to connecting as a network, to doing things that a lot of formal places in our tribal government were doing, but they were doing it in a way, and they championed some of these healing efforts that are happening. So I'm really excited to have seen that, to be a part of that, to watch our children become their own champions. And I think that's a really powerful concept. So no matter what place you are in the work that you're doing with children and their mental health and their well-being, is to recognize that there are all these different parts of our society and our service systems that exist, and to be mindful of, you know, your tools and your impact and the quality of the tools that you use as you work with families. So if there are any questions, I'd love to answer anything that you might have.
So once again, you can put any questions or comments into the chat box. And you can also click the arm icon.
Thank you, Shanoa. Yeah. Thank you, Deanna. Thank you. Feel free to reach out to me. I can be reached by my mobile numbers there. You can text me if you need. You can also email me. There's work that, you know, is always happening at any given time, and I'm always open to sharing more of this information. I think there's only so much you can do on a webinar, but there's a lot of activities that I can recommend and different ways to engage a tribal community. So if there's anything that's pressing or that you want to learn more about, I'm always open to having those conversations. That sounds good. Thank you.
Alrighty, do we have any last questions or comments before we start wrapping up? Alright. Well, thank you all very much for joining us in today's webinar. I'd like to thank Anna, our host, and Debbie, our presenter. So just a reminder that our webinars will be archived on Redwind's website. Just look for the Talking Stick webinar archive under resources. We also will be posting them on our YouTube. You can just type in Redwind when you search it up, and that should bring you to it. We will also be hosting more webinars coming up. Let me take a look, and I will find these for you. So, we will not be having another webinar this month. This will be the last one. And coming up will be let me take a look. Building relationships and connections with children and youth. And that will be on August 19th, 2019. And that'll also be at 1 p.m. for Mountain Time, just like this one. And then after that, on September 16th, will be sexual assault within trafficking in tribal communities. And once again, that one will be on September 16th. We had to change it. And then after that will be legal considerations when providing advocacy to children and youth, and that is on September 30th. And that will be the last of the currently set up dates. And we will send out a webinar when we have the other two webinar is set up. Or we will send out a newsletter when these other 2 webinars are set up. So I'd like to thank you all for joining us. CEUs, Shanoa? I'm not quite sure what you mean.
Those are the continuing education credits is what she's asking about.
Okay. I do not believe so. However, if you'd like to, we can discuss it afterwards. If you'd like to email me, I'll put my email into the chat box. And anyone can use that email if you'd like to get into contact with me or anything like that. I would just like to give a reminder that Redwind does offer one-on-one services such as site visits or personalized calls. So if you have anything concerning from your organization, or if you need help setting up any grants, or if you need a policy reviewed, just know that you can send those in to us, and we will get to them as soon as possible, and we will also set up a call so that we can discuss any changes that need to be made or any site visits. For site visits, we can set up a time or figure out when our next availability will be for that. So, once again, I'd like to thank Anna and Debbie, and I'd like to thank all of you for joining us.
Thank you so much for facilitating.
No problem.